one of the key things is that you do screening, and you do this at regular intervals. And if you're found to have an abnormal screening test, you then go on for diagnostic evaluation. So Ghassan, how is liver cancer diagnosed?
Yeah, I mean, I think both of us already alluded to many components of it. But to be fair, and most importantly, is get a medical history, make sure you meet a doctor, listen to the story, tell them what the symptoms are, if any symptoms, and of course, do a physical exam. These are still quite essential components of the medical care as it is for any other disease. With this said, as you already alluded to, of course, other than we do screening, sometimes with in diagnosis, we need imaging. Imaging means some form of radiology. We can do classically a CAT scan, which will include the chest, abdomen, pelvis. We can do an MRI of the abdomen, pelvis, plus a CAT scan of the chest, or variation of. And truly, we're not necessarily recommending one versus the other. It's simply what your doctor feel most appropriate and what's really applicable for your current situation. With this said, some blood work will be needed. Why the blood work? Because number one, other than that marker, which by the way, the alpha-fetoprotein we spoke about for screening is not an accurate component of diagnosis or accurate component of screening, but this is suggestive of, but nonetheless, we like to do it, we like to check it. But with it, it's very important to look at other parts of the blood work, especially in regard to liver function, how good or bad the liver function is, because it will imply therapy, as we suggested a bit earlier. Add to this, there could be an important component also to look at related matters to the liver function, among which a key element is the platelet count, and to make sure the platelets are within the context of being able to treat. Number two, we come now that we did the testing, we kind of evaluated the patient, we did the imaging, we do the liver function test, but ultimately we still need to confirm the diagnosis. Now here, your doctor might not necessarily suggest a biopsy because if the disease is very early stage, i.e. something that will probably be taken out by surgery or could be treated with local therapy, which we'll talk about, that's okay, that there is confirmation that radiologic diagnosis will be appropriate. However, if the disease has spread out or there's any spread of the cancer, or even sometimes in local advanced stage, you need the biopsy. The biopsy, for some of us, and we hear from patients, they fear it as being like they make it or break it. Absolutely not. The biopsy is very straightforward. It's a needle that will go through one of the lesions in the liver and will take out the tissue. And same time, we'll look under the microscope and we'll find out that it is and confirm it's liver cancer. There could be other things we learn from the biopsy we'll talk about, among which is genetic testing, and we'll dissect that a little bit later.